You might find it surprising, but regularly consuming the wrong type of nuts can increase your risk of heart disease by up to 48%, especially if you're an older adult. There's solid reasoning behind this figure drawn from a multi-year study published in the Journal of the American College of Cardiology. And here's the alarming part. Some of the most common nuts found in kitchen pantries can quietly drive up blood pressure, trigger inflammation, clog arteries, and even worsen cognitive decline. Despite this, many seniors eat them under the impression they're making a healthy choice. One particular nut, which we'll reveal later, has been linked to high levels of a toxic compound that, when eaten frequently, can harm the liver, kidneys, and brain function. Chances are you already have this nut sitting in your snack stash. It's often praised by low-carb enthusiasts as a healthful option, yet it may be causing lasting harm to aging bodies. But don't worry, this video has you covered. You'll discover a thorough guide to nuts. Which ones are the safest, the best for heart health, and the most beneficial for brain function? Plus the nuts you should avoid at all costs. Make sure to stick around until the end because we'll uncover the little-known truth about the most dangerous nut, one that's quietly threatening your health. Before we jump in, give this video a like, subscribe to the channel for more content like this, and let us know in the comments where you're watching from. Now, let's dive into the 4 types of nuts seniors should prioritize. Fourth on the list, almonds, the bone-strengthening powerhouse. Almonds are among the top foods for aging bodies, thanks to their rich calcium and vitamin E content, both of which are vital for maintaining strong bones. As we age, fractures can lead to serious complications since bones naturally become more brittle and porous. After age 65, bone loss accelerates, but eating just 1/4 cup of almonds daily can help slow this process by delivering about 97 milligrams of calcium. Beyond calcium, almonds are also packed with magnesium, a nutrient often lacking in older adults. This combination is what makes almonds stand out. Magnesium acts like a delivery system, ensuring that calcium reaches the bones rather than accumulating in the arteries, where it could cause harm. The healthy monounsaturated fats in almonds also support heart health by lowering harmful LDL cholesterol, a critical factor as cardiovascular risk rises with age. For seniors, I recommend a daily serving of 15 to 20 almonds, preferably raw or dry roasted and unsalted. Almonds are also excellent for promoting regular digestion, offering about 3.5 grams of fiber per serving. Important since nearly 40% of older adults struggle with constipation. Perhaps most impressively, research from Tufts University suggests that almonds may help guard against the oxidative stress that threatens brain cells as we grow older. Opt for almonds with their skin still on, as the skin contains flavonoids that, when combined with vitamin E, double the nut's antioxidant power. A quick word of caution. Almonds can pose a choking risk for seniors with swallowing difficulties, so it's important to chew them thoroughly. Coming in third are walnuts, the brain-boosting nut. With their striking brain-like shape, walnuts are perfectly suited to support the very organ they resemble. They are the richest source of alpha-linolenic acid, a plant-based omega-3 fatty acid, among all commonly consumed nuts. This is especially crucial for older adults, as omega-3s help maintain brain cell membranes and improve neurotransmission. Remarkably, seniors who consumed just 1.5 ounces of walnuts daily for 8 weeks showed notable improvements in cognitive speed and mental agility. A recent study in the Journal of Nutrition also revealed that walnuts' unique polyphenols may help slow the progression of neurodegenerative conditions like Alzheimer's and dementia by crossing the blood-brain barrier and directly reducing inflammation in brain tissue. Another little-known benefit: walnuts naturally contain melatonin, a hormone that typically decreases with age and often leads to sleep disturbances in seniors. Some find that enjoying a small handful of walnuts before bed helps improve sleep quality. Walnuts also combine arginine, an amino acid that supports healthy blood vessels, with polyphenols that reduce oxidative stress, making them outstanding for heart health. In fact, walnuts can even boost the effects of blood pressure medications by helping keep arteries flexible. For maximum benefit, store walnuts in the refrigerator to preserve their delicate oils and aim to eat 7 to 9 walnut halves per day. As a bonus, cracking walnuts yourself can help maintain fine motor skills. Don't be discouraged by their naturally bitter taste. That slight bitterness is actually a sign of their powerful antioxidant content. Next up, in second place, are pistachios, excellent allies in managing blood pressure. Among nuts, pistachios are often underrated, particularly when it comes to their ability to help regulate blood pressure in seniors. Pistachios stand out with their naturally low sodium and impressive potassium content, about 285 milligrams per serving, making them a smart snacking choice. This mineral combination is key for older adults, as it helps the kidneys avoid holding on to excess salt. Research suggests pistachios can lower systolic blood pressure by 3 to 5 points, similar to some prescription drugs but without the unwanted side effects. Pistachios also deserve praise for their lutein and zeaxanthin content, two carotenoids that protect the macula in the eye, helping prevent age-related macular degeneration, the leading cause of vision loss in people over 60. Seniors can also appreciate pistachios for being easier on teeth and gums compared to harder nuts. Beyond their appealing look, the antioxidants behind pistachios' distinctive green and purple colors help combat free radicals that speed up aging throughout the body. For older adults, pistachios are not only convenient, but also encourage mindful eating, helping prevent overeating and providing a calming, cognitively stimulating experience. The simple act of shelling pistachios naturally slows down how quickly they're eaten. According to the International Journal of Obesity, the presence of empty shells gives a visual cue that helps seniors manage portion size. And if arthritis in your hands makes shelling difficult, look for pistachios that are already partially opened so you can still enjoy their benefits. Aim for around 49 pistachios per day, which equals about 1 ounce of unsalted or lightly salted nuts. For the 25% of Americans over 65 who are diabetic or prediabetic, the 3 grams of fiber per ounce of pistachios can be especially helpful in stabilizing blood sugar levels. Taking the top spot, Brazil nuts, a natural aid for thyroid health. Brazil nuts earned first place because they support thyroid function, a crucial but often overlooked aspect of healthy aging. Just one Brazil nut contains 96 micrograms of selenium, or about 137% of the recommended daily intake, making them the most selenium-rich food on the planet. This is particularly significant since thyroid disorders frequently go undiagnosed in older adults, as their symptoms are often mistaken for normal signs of aging. This matters because thyroid conditions affect up to 20% of people over the age of 65. Selenium, abundant in Brazil nuts, plays a key role in activating thyroid hormones, which regulate metabolism, energy levels, and mood. Beyond thyroid support, the specific fatty acids in Brazil nuts help protect myelin, the insulating sheath around nerves, which tends to deteriorate with age. Maintaining myelin can help seniors preserve reflexes, response time, and mental processing speed. What makes the selenium in Brazil nuts remarkable is that it's organically bound, making it more bioavailable than the selenium found in synthetic supplements. Brazil nuts are so potent that only a small amount is needed to deliver benefits, and their creamy, buttery texture makes even a couple satisfying. In fact, I recommend older adults limit themselves to just 1 or 2 Brazil nuts per day, as too much selenium can have harmful effects. When shopping, look for Brazil nuts still in their shells. This natural packaging helps preserve their nutrients for longer. Because of their high fat content, it's best to store Brazil nuts in the refrigerator to prevent spoilage. Thanks to their mix of fiber and natural oils, they also help promote digestive regularity, offering extra support for seniors dealing with constipation. While many older adults turn to less healthy snacks for comfort, Brazil nuts provide a more nutritious alternative with their naturally sweet, buttery taste. Perhaps most exciting, Emerging research suggests that some antioxidants in Brazil nuts may help slow the shortening of telomeres, the protective caps on chromosomes that gradually shrink with age and influence cellular aging. For those 65 and older, these nuts are a fantastic addition to the diet. Now let's turn to the nuts that seniors may want to avoid or consume with caution. Coming in as inflammatory trigger number 4, peanuts. Despite their popularity, peanuts pose risk for many older adults. First, it's important to note that peanuts aren't true nuts. They're actually legumes that grow underground. This makes them especially prone to mold and aflatoxins, which are toxic substances produced by certain molds and can damage the liver or raise cancer risk when consumed regularly. As we age, our bodies become less efficient at detoxifying harmful compounds, making this threat even greater. Another concern for seniors is that peanuts contain proteins that can trigger inflammatory reactions in some people, even if they don't have a diagnosed peanut allergy. Since older adults are already more vulnerable to joint pain, cardiovascular strain, and cognitive decline, this low-level inflammation can worsen all three. On top of that, most Americans already consume too many omega-6 fatty acids relative to anti-inflammatory omega-3s, and peanuts' high omega-6 content adds to this imbalance. What's more, many healthcare providers fail to caution seniors about a potentially dangerous interaction between peanuts and blood thinners like warfarin due to the vitamin K content in peanuts. The inclusion of hydrogenated oils, added salt, and sugars in most commercial peanut butters only amplifies the risk they pose to aging cardiovascular systems. With 63% of American seniors already dealing with high blood pressure, this is a pressing concern. Even natural peanut butter, when unsalted, can still contribute to elevated blood pressure levels. Another issue is that peanuts can turn rancid if improperly stored, leading to the formation of harmful free radicals. On top of that, the common industrial practice of dry roasting peanuts produces acrylamide, a compound with potential negative effects on cognitive function, a particularly troubling issue for seniors already anxious about memory decline. Even if you've been eating peanuts regularly without noticing adverse effects, swapping them out for some of the recommended nuts just 3 days a week can provide you with essential nutrients while reducing your exposure to these harmful elements. Coming in at third on the caution list, cashews, the hidden sugar concern. Cashews carry a unique risk for older adults because of their high carbohydrate content and glycemic load. Compared to true tree nuts, cashews contain significantly fewer protective fibers and compounds and far more carbohydrates, with about 9 grams per ounce. Given that roughly 25% of those over 65 have diabetes and another 48% are pre-diabetic, the blood sugar spike triggered by cashews can pose a real threat. What makes this particularly troubling is that cashews have a health halo, leading many seniors to eat them in large quantities without considering their impact on blood sugar. Their smooth, curved shape also presents a choking hazard, especially for older adults who have difficulty swallowing. In fact, cashews rank among the nuts most frequently aspirated by seniors. From a nutritional standpoint, cashews are less impressive because they contain a high level of oxalates, compounds that can bind to calcium in the digestive tract and reduce its absorption. This is a serious concern for older adults already vulnerable to osteoporosis. For individuals over 60, the risk of developing kidney stones also increases substantially due to these same oxalates. Another often overlooked issue is the processing required to make cashews edible. They undergo extensive treatment to remove urushiol, a toxic substance also found in poison ivy, which diminishes their nutritional quality. Moreover, many commercially available cashews are oil roasted and heavily salted, adding unhealthy fats and excess sodium that can further strain blood pressure and cardiovascular health. Cashews also contain enzyme inhibitors that can interfere with protein digestion, a particular challenge for seniors who already tend to struggle with properly digesting food and absorbing protein. This fact often goes overlooked. Adding to the concern, cashews' smooth, creamy texture makes them especially easy to overeat, potentially contributing to unwanted weight gain during a life stage when maintaining a stable weight becomes increasingly difficult. A simple solution is to regularly replace cashews with walnuts or almonds, which offer superior nutritional benefits while posing fewer risks to aging bodies. Coming in second on the caution list are macadamia nuts. Despite their luxurious flavor, they present notable health concerns for older adults because of their extremely high calorie density. At roughly 200 calories per ounce, macadamias top the chart as the most calorically dense nut available. Combine that with the fact that metabolism naturally slows with age, and you have a real hurdle for weight management. Their extraordinarily high fat content, around 22 grams per ounce, also puts added strain on the gallbladder, whose efficiency often declines with age. For the roughly 15% of seniors with silent gallstones, consuming macadamias could potentially trigger painful episodes. Furthermore, macadamias rank among the highest in saturated fat, delivering about 3 grams per ounce, which can elevate LDL cholesterol, a pressing concern for many older individuals. Their density and hardness also raise red flags for oral health, particularly for seniors with crowns, bridges, or weakened teeth, as enamel naturally erodes and calcium absorption drops past age 65. From a practical standpoint, macadamias are among the most expensive nuts, which may drive budget-conscious seniors toward cheaper, lower-quality options that are prone to rancidity or improper storage. Increasing exposure to harmful oxidized fats. Commercially packaged macadamias often compound these problems, as they're typically oil-roasted and heavily salted, adding more unhealthy fats and sodium to the mix. Their rich, buttery flavor makes them especially tempting and easy to overconsume, particularly among older adults whose taste preferences may lean toward bolder, more indulgent flavors. What's especially troubling is that many seniors eat macadamias under the impression that they're boosting heart health. Yet, most research highlighting the cardiovascular benefits of nuts has largely overlooked, or quietly minimized, the role of high-fat varieties like macadamias. A far better alternative for aging bodies would be pistachios, which boast a much stronger nutritional profile. So, if you've been indulging in macadamias regularly, it may be wise to consider switching to alternatives like pistachios. Now, let's talk about pine nuts, the first nuts we get from the pine tree and, surprisingly, one of the riskiest for seniors. Pine nuts pose several unique challenges for older adults, and one of the most serious is their potential to interfere with medications. Alarmingly, compounds in pine nuts can interact with over 60% of the prescriptions commonly taken by seniors, potentially reducing drug effectiveness or introducing harmful side effects. While drug interactions are always a concern, they're particularly notable with medications like statins, certain antidepressants, and blood pressure drugs, all frequently prescribed to people over 65. Unfortunately, many doctors and pharmacists don't warn patients about these food-drug interactions, which is a concerning oversight. Even more troubling is a condition known as pine nut syndrome, which leaves a persistent bitter or metallic taste in the mouth that can last for weeks after consumption. While this might sound like a minor nuisance, it can have major repercussions for older adults, as changes in taste are closely linked to reduced appetite and nutritional decline. In fact, studies show that up to 42% of affected individuals experience significant weight loss, a serious risk for seniors. Aging appears to increase susceptibility to this syndrome, possibly because of changes in taste receptors and slower detoxification processes. Pine nuts are also packed with polyunsaturated fats, which are prone to oxidation, potentially producing inflammatory compounds that can exacerbate conditions like arthritis. Their small size and slippery texture add another layer of risk, as they can easily be aspirated. A major concern for seniors who struggle with swallowing or experience dry mouth, a common side effect of many medications taken by over 70% of older adults. Compounding the issue, pine nuts contain enzyme inhibitors that can hamper protein digestion, a critical concern given that protein absorption naturally declines with age. Their high oil content also makes them a calorie-dense food that can complicate weight management, especially since pine nuts often appear hidden in dishes like pesto, where portion control is difficult. Even more concerning, emerging research suggests that compounds in certain pine nut varieties may accelerate age-related macular degeneration, the leading cause of vision loss in seniors. In summary, after age 65, it's best to avoid these four nuts. Thoughtful choices about which nuts to include or exclude from your diet can have a powerful effect on your health, energy, and cognitive function as you age. Last but not least, remember, small, consistent changes can lead to big results over time. Now it's your turn. Have you noticed any impact on your health from adding or removing certain nuts from your diet? Share your experiences and insights in the comments. We'd love to hear your story.